New Ulm Medical Center is a hospital representing Brown County and its surrounding area. It is part of the Allina Health System. New Ulm Medical Center is a nonprofit organization accredited by the Joint Commission and also received the Innovation of the Year Patient Care Award. New Ulm Medical Center is a hospital made up of many different practices. They include family practice, internal medicine, general surgery, pediatrics, orthopedics, OB, gynecology, radiology, emergency medicine, psychiatry, mental health, substance abuse, home care, and hospice. New Ulm places a high priority on their mission statement. It is stated as, "We serve our communities by providing exceptional care as we prevent illness, restore health, and give comfort to all who entrust us with their care." They also provide a lot of emphasis on their philosophy, which includes integrity, respect, trust, compassion, and stewardship. These are simple words to match their actions of treating everyone with dignity and courtesy, acting in the best interests of the patients, physicians, communities, and one another. This also is creating a caring environment for patients, families, and staff, and using resources wisely. New Ulm Medical Center creates a vision by combining their mission statement and philosophy. It is stated as, "We will put the patient first, make a difference in people's lives by providing exceptional care and service, create a healing environment where passionate people thrive and excel, and lead collaborative efforts that solve our community's healthcare challenges." Throughout our clinical experience at NUMC, we were able to evaluate whether or not they exhibited their mission statement. We believe they did honor their mission statement. This was proven through many ways. Every morning, the president of NUMC approached every patient and addressed their needs. They also provided trust by participating in bedside report. Their care was delivered in a compassionate and qualitative manner. They also had equipment readily available in each patient room, which decreases wasted time and allows for cares to be done at once rather than needing to continuously bother the patient. Documentation systems are also located in the rooms, which helps limit distractions and decrease errors. Patients' concerns were also continuously addressed. LPNs and RNs are the two types of nurses at NUMC. The LPN's role is to be a direct assistant to the charge nurse. They would gather vital signs, assist in activities of daily living, gather medications, and deliver them, excluding the IV push meds. The rest of the RNs were responsible for these activities. The charge nurse and the RNs also had many roles, including shift report, assessments, care planning, interventions, evaluation, delegation, patient teaching, patient discharging, applying treatments, administering medications, and being a patient advocate. NUMC uses primary nursing as their healthcare delivery model. According to our Week 9 module, this is defined as where one nurse is responsible for all aspects of care and coordination of care for the patient assigned to them. This works best in all RN environments, and the idea here was that with one nurse who was following the patient closely, they could be more on top of that patient's needs. NUMC follows the criteria of primary nursing by making individualized care plans and making changes as needed based on their follow-up assessments. Given the fact that there are no nursing assistants, assessments are very detailed because this gives the nurse an opportunity to complete a full head-to-toe assessment without impairing the patient's dignity. Their cares and progress is easily evaluated due to the fact of having primary nursing and effective communication. Primary healthcare has a lot of advantages, but there are also some disadvantages. A lot of job opportunities take place in the less desired shifts due to the fact that primary healthcare deals with all of the patient's needs. Since being part of a specialty isn't always an option, there is also generally lower pay with primary healthcare. By not having as many specialty options, you need to be knowledgeable in a wide variety of healthcare areas. Another downfall is that a lot of your patients are going to be chronically ill and may not greatly improve. Decision-making is a joint decision among staff members. After speaking with Katie Rader, an RN who has been employed at NUMC for 17 years, she stated that they place a lot of emphasis on their communication to facilitate decision-making. Every month, there is a staff meeting for each department to address their concerns. They also have a professional practice group which is composed of RNs, managers, and the administrative team to analyze problems and initiate ways for improvement. The staff that are not in the group are able to approach group members to voice their opinions. This is a way to advocate for patients and staff members. Communication is very effective at NUMC between the healthcare team. The physicians, nurses, and social workers all work hand in hand to provide qualitative care. At NUMC, they prefer to relay information face-to-face, which is allowing an opportunity to obtain clarification and details when they're needed. They also communicate through the SBAR format. Administration is a little harder to communicate with, however, administration prefers to relay information through email. A lot of consideration goes into choosing where to work. NUMC has a lot of positives to aid in your decision making. The starting wage for an RN is $27.75 an hour. They will also provide a tuition reimbursement of $2,500 to further your education. NUMC is part of the Allina healthcare system, which allows the opportunity for great benefits including health insurance, dental, and vision. NUMC prefers to maintain 8-hour shifts and provides cross-training to decrease the possibility of burnout and increase flexibility. The community where NUMC is located also aids in the decision on working there. Since it is a smaller community, there is a higher chance of knowing your patients or the families on a personal level. This can either aid or impair the care delivered and also opens a door for an accidental breach of HIPAA. NUMC has a career statement stating, "People choose to work at Allina for a variety of reasons: rewarding work, our reputation in the community, advanced technology, competitive compensation, financial stability, and more." Finding the right fit at the right time is an important way to enrich your connections with your patients, colleagues, your community, your family, and your lifestyle. Overall, we feel that NUMC has a lot of positive qualities and does honor their mission statement and philosophy. I hope you have learned a lot about NUMC through our presentation. If you would like to obtain more information, please visit the link provided.